You know, oftentimes when we think about serious injuries, we think about, you know, broken legs and broken arms and, you know, injuries that might tear ligaments and things like that. But we often don't think about what might cause those injuries. Sometimes it's something as simple as a fall. In fact, many times it's something as simple as a fall. Here to talk to us today about some of these statistics and injuries and things that happen from falls is Kathleen Ream. She is the Volunteer Services Coordinator for RSVP with Polk County. Dr. Daniel Height, he is the Vice President of Community Health with the Lakeland Regional Health Systems. Doctor, thanks for coming on.
Welcome.
And we also have Lonnie Lebanoff. She is interning with Dr. Height and the Lakeland Regional Health System. Lonnie, thanks for coming on.
Thank you.
As I alluded to in the intro, you know, falls are something that we don't really think a lot about when we think about serious injuries. But let's be realistic, this is a major issue, isn't it?
When you think of what we do at Lakeland Regional Medical Center, it's all about patient safety, getting the best care possible to our patients. But when patients leave the hospital, they often have risks for injuries. And these injuries could be, like you said, car accidents, animal bites. I mean, injuries are galore, but the most common injury is what you said, falls. And we actually have a diagram that shows who is falling. And you look at the numbers that when you enter the workforce, falls start to increase a little bit. But when you get to age 65, the falls that lead to death go way up. Wow. And that is pretty shocking, but even more concerning are those falls that lead to an injury. That can cost up to $40,000 for the surgery and the recovery, but I'm also worried what it does mentally. And part of the conversation Lonnie was describing is what happens, you know, to that person,
right,
you know, after you fall, because you've got to live with that injury.
Not only live with that injury, but a lot of times a fall is the first major injury that somebody is faced to acknowledge their waning health. You know, their body is starting to age, it's starting to deteriorate, and what would have been a minor incident as a younger man or woman now becomes a major injury. I would imagine that even that mental aspect of it takes a toll, right?
Yeah, actually, Brian, just like what you were saying, all of us fall all the time, and if you or I fell in a grocery store, maybe we would just brush it off and laugh. But what we as children and grandchildren, neighbors, or anybody really have to think about is that our loved ones that are older can, if they fall, they'll fear that. They'll be scared of doing it again, and that can cause them to not want to leave their homes. It'll cause them to be isolated, to not have the physical activity that they need to have. And so something that we can do is we can really work on helping them encourage that physical activity, or encourage them to socialize more.
Right, which is where RSVP comes in, because we are looking for ways to engage seniors beyond, you know, their normal.
What does RSVP stand for?
It stands for Retired and Senior Volunteer Program. We're a grant-funded program through the county, and so I connect a person who wants to volunteer with a volunteer opportunity.
Okay.
And my volunteers are all 55 and older, so a lot of the people that Dr. Haight is referring to that potentially would run into a you know, something in the way of a life-changing experience after a fall are typically the people I'm connected with. And these volunteers really tell me all the time how volunteering changes changes their lives because they feel a sense of purpose, but also because it really changes their well-being. There's scientific research out there that shows that if you're physically active and you're doing something as far as socializing with other human beings, that's all a very round circle as far as an individual's well-being. And also probably lends to their recovery after a serious incident like this fall. So maybe would even decrease the fatality rate.
Well, you need a great network. I mean, I think for all of your viewers, they have friends, relatives, neighbors, And we're all at risk for falls. And if we have that eagle eye that can look for those risks, so if you know somebody that's been just discharged from the hospital, if you're there helping them, you know, look for those things that could cause a problem. They may have received a new medicine that's helping them, but it might make them dizzy or sleepy. Well, those are the kinds of things where let's look at what the environment could actually put them at risk. There could be things in the room that they live in their bedroom, that is a trip hazard, things that might be slippery. But then there's also things they can do personally, like the programs, like Lonnie said, that make you stronger. But I think you were saying not just to make you stronger, but to interact with other people. How, you know, that's pretty important.
Yeah, because after they've fallen, they're scared of going outside, like I said, and so that makes them dependent on other people, and that takes away their sense of purpose. They feel very powerless, and they feel like a burden on their loved ones. So you really want to get them out there so they can feel like they have purpose again.
You know, I'm sitting here and I'm listening to all these different, you know, effects that a fall can have on someone, and that's what people don't think about. They don't think about, you know, the long-lasting effects of an injury that occurs from something that you wouldn't consider a major hazard.
And it might be that we may not feel it, but I have met a number of people in their 50s and 60s and 70s. They think about it a lot. And I think as children and grandchildren, we don't realize how worried they are. And maybe that's why they're not going out and getting groceries as often. That might be why they're losing weight, you know, or they're not as fit or nimble or flexible. And that can be spiraling down, as you said. You know, you go out less, you exercise less. You're more at risk for a fall, and if you do fall, you're not going to recover as well. So I'm pretty worried about that, because that's a big issue.
What are some of the things that people need to look out for that could cause a fall?
Well, I have a couple of photographs here. I mean, these are some helpful aids, and we could show these in some detail. But it's a little bit of a average room, but you can see, like, Lonnie, what kind of things do you see in that kind of photograph?
So this, first let's start with the good things in this. So it's lit, which is a good thing, so you
Lots
can see the possible fall objects. But what you want to avoid is you can see a cord that's in the walkway, you can see a rug that someone can trip over. There's a lot of clutter on the floor, and so you want to prevent those things.
Here, I like this one here, is a picture of a bedroom. And you know, you just got out of the hospital and you're given a medicine that might cause you to go to the bathroom a little bit more frequently. Well, if your walker is across from your bed, you might fall. Or if they've just given you a medicine that has lowered your blood pressure, it might make it a little too low, especially in the middle of the night. You stand up, you take your first step, and you fall. So that walker shouldn't be all the way over there, and there's no lighting. So the right way, you know, keep it close to the bed, and there's no bed sheets there to trip over. And there's a night light that helps you to guide your path. And then you've been told, be careful getting up. Sit on the side of the bed for a couple minutes and make sure you're okay and you're planning those first few steps. There's a lot you can do, but that's just inside the home. I think there's a lot of programs that insurance companies have that are fitness centers.
Yeah, there's a lot of people are not aware of what's offered within the Polk County community. In the fellowship dining programs, before those, Parks and Rec has free exercise classes. RSVP is currently putting together a Bone Builders program that's going to be starting out in the Wabash area. And that program is using small hand weights, free exercise classes where people can just lift weights in a group under the direction of a volunteer class leader. Additionally, the Silver Sneakers program, that's a national program. Everybody's heard of it, but they really don't understand it. That's through their insurance company where they can have access to a health and fitness center. So the YMCA's typically have special programs for Silver Sneakers, you know, members.
At no additional cost. I mean, that is, you can have access to the YMCA along with classes that make you stronger. You socialize and get to have other friends there, and you get to be more balanced. Even a class called Tai Chi. Now, Tai Chi, it's a good, you know, easy going to get your balance It's enjoyable. There's even chair yoga, for folks that need a little extra support. But these programs are at your own pace.
Right.
And they keep you a lot stronger. But the AARP, the Blues Foundation, different Silver Sneakers through some of the Medicare supplements, they're there to help. And I'm pretty impressed. In fact, even AARP would even give you advice on what to look out for in your home. The Blues Foundation has seminars that can also help, with fall prevention throughout the year. So there's some pretty good help here in Polk County.
Excellent. What kind of information is available for folks who are worried about falls? Obviously it may take, like you showed in the pictures, it may take adjusting your lifestyle a little bit. Maybe you're used to having a little clutter around the house and it doesn't bother you, but just those simple things that you can adjust, information to help them, guide them along.
I think it first starts with your physician. I mean, we all need a regular checkup. And many of us can be on a number of medications. Some of those medications put us at high risk for falls. They could even be in our cabinet at home for some of those sleep aids. I won't name particular ones, but the ones that help you get a little drowsy. Well, those could make you have some trouble walking in the middle of the night. But starting with your physician may know that you're on a blood thinner. Hey, if you fall, you could have uncontrollable bleeding. So that's an additional issue. You may be on a heart medicine. You may be on a heart medicine that might make you dizzy, or blood pressure medicine. So start with your physician. You could have Parkinson's disease, which causes you to shuffle your feet, and that may cause you to trip.
Look for a program, when you're well, to keep yourself physically active, because that will help really almost, make a fall less of an incident.
Yeah, and there's, I think maybe for future programs, we could show you some things that could help you assess that. There are tests to say, can you stand up from a chair, get up without pushing off, and walk a few feet, 10 feet, and come back down within so many seconds? If it takes you a while or you're a little unsteady, you're at risk for a fall. And I've even seen a physician ask a patient to get down on a clean floor and without any help, get up off the floor by themselves. Now, that could be a challenge, but that's an eye-opener. If you have trouble doing that, what if you fell? And if that was in the bathroom and you didn't have handrails in the bathroom? I knew one lady who actually, she would put her cell phone on the floor in the bathroom in case she fell in the bathroom. She'd have her phone there on the floor, so it was ready to go. But those kinds of ideas, it's so wonderful to talk about it. So sons and daughters, need to share this kind of concern. And I know sometimes, and in fact, I'm not planning on falling. Personally, are you planning on falling? We're not planning on falling. I think everyone out there,
not in my date book anyway.
We're not planning on it, but it happens.
Unfortunately, I don't think any falls are planned.
Exactly.
But,
and that's
but they potentially could be prevented.
Absolutely.
And as loved ones, we should be ready for that. We need to be understanding to be able to talk with them if we need to have that talk with them, and to just help them through that, get their hearing checked or their vision checked.
Yeah.
Prepare.
It could be I don't need any help, or I'm used to my home, but that's a key factor. Everyone's used to their home. Most people in their 40s plan on staying in their home and not planning on leaving. So after 10, 20 years, I've always stepped over that carpet, and I never trip. But come on, one of these days I'm going to trip.
You're going to bite it.
So being acceptable of that, accepting that kind of advice, and being able to gently say, I know you've never tripped over this, or that step. That last step should be a different color than the step before it, so you're at the end of the stairs.
Well, guys, this has been an eye-opening conversation, definitely. It's something that you don't really think about a lot until it's time to really think about it a lot. But with September coming up, it's a great time to think about falls and the loved ones around us. Thanks so much for coming on.
Well, you're welcome.
Thank you.
That's the Lakeland Regional Health System and, of course, Polk County RSVP program working with the seniors. Like Dr. Haight said, this is not something that's planned. It's not something that you are prepared for necessarily, but we can be. We can be preventative in nature. We can clean our houses up. We can get rid of the clutter. We can consult our doctors, all these things that we mentioned before. So it's really simple. A great resource is the NCOA website. If you go to that at www.ncoa.org, if you find the link for Improve Healthcare, then find the link for Center of Healthy Aging, you'll be able to find lots of information about falls and get yourself on the way to being safer around the house and around your community.